NICU Parent Network and one of the FCC Task Force core team co-chairs. Thank you for joining today's FCC Task Force webinar, which is generously supported by Reckitt Mead Johnson and Draeger. We are delighted that you have carved out time to be with us today. You know, they say people make time for what is important to them. And so we are grateful that you recognize the importance of strengthening family-centered care practices. So please let us know that you're here by putting your name, role, and location in the chat. Next slide. Each webinar that we produce is dedicated to the NICU children of one of our family partners. And today's webinar is dedicated to one of today's speakers, Kelley. Kelly's children, Jackson and Lauren, were both born premature and now are thriving young adults. Next slide. The work of the FCC Task Force cannot be successful by working in silos. So we are honored to include several esteemed national multidisciplinary organizational partners. Next slide. Our bi-monthly webinar series is generously supported by Reckitt Mead Johnson, which provides 120 years of science-based pediatric nutrition expertise focused on helping provide babies the best start to life. Next slide. And by Draeger, whose mission is to provide technology solutions that allow caregivers to work efficiently, parents to nurture, and infants to thrive. Next slide, please. The FCC Task Force has adopted the Next Society's All-In Meeting Guide. This meeting guide provides a framework for fostering equity and equality in healthcare meetings, creating a sense of belonging and community among healthcare partners and family partners. We utilize this guide to break down the hierarchy that is common in healthcare. And one of the ways that we do this, as you'll notice, is that we will be addressing our guests by first name. We also encourage you to raise your hand during the Q&A portion of today's webinar, and please add your thoughts and comments and questions in the chat box throughout the presentation. FCC Task Force believes that being family-centered is not relegated only to the bedside, but really is part of our all-encompassing organizational culture, where family partners and healthcare partners are of equal importance. And we demonstrate this through our processes and our culture. Next slide. The task force is led by our core team with neonatologists Malathi Balasundaram and Colby Day, alongside myself and family partner Morgan Kowalski. Morgan really is the one that keeps us all in line. Next slide. We also have an executive council of family partners made up of diverse birthing and non-birthing parents and caregivers, and we are supremely grateful for their time, commitment, and expertise. Next slide, please. Our Executive Council of Healthcare Partners is a multidisciplinary representation of the many clinical disciplines involved in the care of babies and families. And we thank each of them for giving their time and expertise so freely to this work. Next slide. We would like to welcome our newest Executive Council members, Mary Coughlin, who's a trauma-informed professional, president and founder of Caring Essentials Collaborative, and Amy Finn, NICU parent of Piper, and the Programs and Events Coordinator at Project NICU. Next slide. In addition to the core leadership team and our executive councils, the task force has 3 committees that is each are co-chaired by a healthcare partner and a family partner. Again, putting into practice equal representation of families and clinicians. Next slide. Our latest newsletter is now available if you haven't already seen it, and we really encourage you to please share this with your team members. Our data has shown that the centers who are sharing the webinars and the newsletters with their team members are having more success with the FCC work in their unit. So it works. Next slide. I would like for us to pause for just a minute and celebrate. Today marks our 2-year webinar anniversary, and I really do have to give a special shout out to Malathi and Colby because this would not have happened without their focused leadership. So we want to thank you for taking an idea that you had in early 2022 and dedicating so much time and effort to making it sustainable. Next slide. As you can see by this slide, Malathi started this work back in February of 2022 with a simple email to 50 potential members, and you can see how we've grown. I believe Morgan actually checked today, and we are nearing 1,000 members in 43 out of 50 US states and over 30 countries. So thank you guys so much for being here, and thank you for your leadership, Malathi. Next slide. Morgan has created a database of all of the FCC Task Force webinar recordings. We encourage you to scan this QR code to access that database directly. And then you'll also find them listed under resources on fcctaskforce.com on the website. So again, please share these with your team members. Like we said at the beginning, the data is showing that when this information is shared, you will have more success in your unit. Next slide. So each month we put up a poll based on questions that are posed through the listserv. And this month's poll is specifically for our family partners. So if you would please take the time to scan that QR code, we encourage our family partners who are here with us today to answer the poll. And then also please take it to your team members within your organizations or your hospital, your family partner team members. And let's see what we can do with this poll and really get some great information about tracking milk production through an app that could be linked to electronic health records. We've got the QR there, and then Morgan has also shared it in the chat. Thanks, Morgan. Next slide, please. So this year we have implemented monthly office hours where we have kind of a small group setting to share our challenges and our successes. And you can see with our most recent office hours discussion, we had such a rich discussion. Just you can tell by the comments that Morgan was able to collate from that set of office hours. It really was wonderful. So we would like to encourage you to attend these. Next slide. Later this month, our office hours will be facilitated by family partner Lewis Vernon and healthcare partner Daphne Barbeau. And I'm sure will be equally insightful as we will be focusing on the topic of information sharing with NICU family. Next slide, please. So I am delighted to introduce a very good friend and colleague, Kelly D. Kelley. She is the founder and CEO of Hand to Hold, which is a national nonprofit organization dedicated to providing education and support for neonatal intensive care unit and bereaved families. A NICU graduate parent who suffered from psychosocial issues for years after her children's early births, she now invests her time and talents to raise awareness about the high incidence of anxiety, depression, and post-traumatic stress disorder among these parents and the long-term implications for the baby. Thank you, Kelly. It's all yours.
Thank you, Kira, and I'm delighted to be here and have the opportunity to present today. It's an honor to see so many people that I love and respect on this call, and just be very happy to be part of this group and working together to better outcomes for NICU babies and families. So I'm just going to start with a little bit about my story and kind of what brought me here today. 24 years ago, I went into preterm labor while I was driving in rush hour traffic. To this day, the memory plays like a movie in my mind, conjuring up the pain and fear and uncertainty that I experienced as those first labor pains rolled over my body as I slowly inched my car forward on the freeway. Morgan is running my slides for me. So Morgan, there you go. Upon arrival at the hospital, I underwent an emergency C-section, and my son was born at 24 weeks, weighing 1.5 pounds. When I first awoke from surgery, I was just overjoyed to learn that my son had survived. I didn't know a baby born so early could survive 24 years ago. I was told he was in the neonatal ICU, the NICU. I'd never even heard of those 4 letters. They were very foreign to me at the time, but they would ultimately transform my life and my experience as a parent and my professional career, and ultimately my life's purpose. When the nurse came to take me to see him for the first time, I vividly remember not wanting to go. I felt tremendous guilt for not wanting to meet my son, but I didn't think that I could handle seeing him so tiny and sick and hooked up to all the machines. And my husband had tried to show me some Polaroid pictures of the baby, but I just found it too difficult to look at him. And I actually just put those pictures, tucked them under the Kleenex box on my bed. So when we first arrived at the NICU, the doctors talked to us about the challenges Jackson would face during his first hours and his days, first days, weeks. We were told that night, just hours after his birth, that he may have mental retardation, he may have cerebral palsy, he may have vision problems, he may be deaf. And the list was long and it was overwhelming. I was overcome with emotion and I asked to go back to my room. My husband felt an immediate bond with Jackson, but for me, it took a long time. I was very scared to love him because I knew how close we were to losing him. I watched him be resuscitated many times. I felt more like a bystander than a mother. I couldn't feed him or change his diaper or even speak to him in a voice above a whisper. And my heart and my mind battled throughout that time, telling me not to love him because it was going to hurt more when he died. And I would later learn that that's called anticipatory grief. And it's common among NICU parents as we're trying to shield ourselves from the excruciating pain of losing our baby. I will say no one talked to me about my mental health and my risk for perinatal mood disorders following the traumatic birth. The social worker only met with us regarding paperwork, not to offer emotional support or invite me to a support group or guide me to resources in the community. On the day of my hospital discharge, I did finally break down. A nurse had parked my wheelchair by another mom. And of course, she was going home, but she had her baby in her arms. She had flowers. And I just began to sob. And the nurse knelt down and softly asked me to please not ruin that moment for the other mother. And I tell you, I didn't question her lack of empathy for me. I immediately pulled myself together. It was just a loud signal to me not to talk about or express my emotions, which would ultimately exacerbate my mental health challenges for many years beyond the NICU. We were sent home with a heart monitor, CPR instructions, and a long list of medications and doctor's appointments for follow-up. But one thing we did not receive was a mental health assessment or resources we could turn to in our community for continued support once we were home caring for our medically fragile baby alone. What I didn't know then was that mental health resources for NICU parents were desperately lacking. This was 24 years ago. It was not widely understood that infant parent separation in the NICU created an increased risk of developing PTSD. It would be more than 5 years after my son's birth before I received my official diagnosis of an acute anxiety disorder and PTSD, and another 10 years before my husband would finally seek professional counseling for his symptoms. And while our story does have a happy ending, so many don't. A traumatic birth and a NICU stay increases a mother's risk for developing perinatal mood and anxiety disorders by 70%. Mothers of color are at a greater risk and face additional barriers that may make accessing care more challenging. But left untreated, PMADs harm bonding by impairing the mother-child interaction. Moms are less responsive to their baby's cues. They have fewer positive interactions with their baby, and they often experience breastfeeding challenges and question their competence as a mom, which can have a devastating impact on a child's cognitive, social, emotional, and self-regulatory abilities. Mothers with PMADs are more likely to neglect their babies and are at a higher risk for maternal substance abuse and suicide. Neglect can be a disregard for bonding with the baby, failure to take precautions to protect them from illnesses like RSV, and missed follow-up of care, so much for which is so important for their long-term outcome of a NICU grad. Support to mitigate the impact of HEMATs is imperative for NICU parents, as their babies are medically fragile at discharge and often require medical equipment, ongoing medications, and follow-up appointments, just as my son did all those years ago. In order for NICU babies to thrive after discharge, they need smart, informed parents who understand their needs and are emotionally and physically capable of caring for a medically fragile child. NICU parents need a support system. They need better access to information and resources, and they need to be better educated about their risk and long-term impact of perinatal mood disorders. I founded Hand to Hold to help improve mental health outcomes for NICU parents, and in turn, better long-term medical, developmental, and emotional outcomes for babies. Today, Hand to Hold is a lifeline for thousands of NICU families annually, as we are one of the few nonprofits that are dedicated exclusively to providing NICU and bereaved parents with free, bilingual, early intervention mental health support, led by our certified mental health peer specialist and licensed counselors. Hand to Hold closes critical gaps in maternal mental health care, providing free mental health support programs for NICU and bereaved parents before, during, and after a NICU stay. Morgan, we are now on slide 8. Both the World Health Organization and the American Academy of Pediatrics recently released new recommendations that include education, counseling, discharge preparation for health workers, and peer support for NICU parents. Hand to Hold support model helps hospitals meet and exceed these care recommendations. I think you're one ahead of me, Morgan. Exceed these care recommendations by providing 3 levels of parent support: peer support and education, support groups, and counseling. We know that early intervention support can reduce the experience of isolation, increase confidence, and enhance opportunities for bonding, all of which support a healthy beginning for the baby. We provided more than 72,000 sessions of support last year and are working toward a goal of 100,000 sessions in 2024. It's important to us that our staff and our board reflect the families we serve. 100% of our leadership have a NICU experience, either as a NICU parent or a medical professional. Our family support specialists are NICU and bereaved parents who have extensive training to prepare them well to work with families in trauma. There are 2 ways that Hand to Hold supports NICUs. More than 100 NICUs currently across the country refer their NICU families to Hand to Hold, utilizing our referral cards, which outline the many ways we provide support, including weekly support groups, National Peer Mentor Program, and our free counseling, which I'll tell you more about. Our partner hospitals secure funding to contract with Hand to Hold to provide family support in their NICUs. For more than a decade, Hand to Hold's team of certified mental health peer specialists have provided direct support at the bedside in these high-level NICUs in Austin. And while we have not yet had our formal announcement, I'm very excited to share with you today that Hand to Hold is beginning a contract with Texas Children's Hospital. Morgan, next slide. This is one of the largest NICUs in the nation, certainly in Texas, and we're very excited to be partnering with Texas Children's to bring our bedside support program directly to parent bedsides there. We're also piloting a cutting-edge hospital model to provide virtual support at the Woodlands in Houston. This is an innovative approach to providing families unprecedented access to resources, guidance, and community through their mobile device, be it from the comfort of their own home or at their baby's bedside. We tailor our support to meet the needs of each of our hospitals, including the number of staff we provide and the number of hours we provide in each unit. Our family support specialists are integrated into the NICU team, rounding to meet with each family and providing individualized and group support in English and Spanish. Again, our staff are not volunteers. They are NICU and bereaved parents. Next slide. They have extensive training and they receive certification as mental health peer specialists so they can work in a traumatic environment. By being in the hospitals, our team is able to establish deep, trusting relationships that continue well after hospital discharge. Next slide. We facilitate annual educational programs for both staff and families, which highlight the benefits of breast milk, skin-to-skin contact, kangaroo care, and reading, and how these can help families create stronger bonds with their babies. Next slide. Our weekly support groups are well attended. Our family support specialists, they utilize our proprietary curriculum that we have developed and host groups in both English and Spanish. We seek to help parents normalize their NICU experience, connect with other parents, and find ways to celebrate along the way. We think it's so important for NICU parents to celebrate Mother's Day and Father's Day, as it really helps them support that bonding process with their baby and realize they are parents in the NICU. We also know that holidays can be especially hard for families, so we plan lots of fun ways to celebrate throughout the year. Next slide. Another way we help parents celebrate is through our Milestone Bead program. Parents receive the necklace as a way of celebrating the birth of their baby, and they receive a bead to recognize each special parenting milestone, including the first diaper change and bath and bottle. These are important major milestones that help normalize parenting in the NICU, and it helps break down barriers, allowing parents to be integrated into the care of their baby early in their NICU stay, to help them begin to feel like confident caregivers to their medically fragile baby, which is so crucial at discharge and beyond. Recently, a mother told us that every night before she goes to bed, she puts her milestone bead necklace in her nightstand. And when she wakes up in the morning, she puts it on because it can help her feel like she can conquer another day in the NICU. And I think that's a really powerful piece of jewelry and so much more than just a necklace. Hand to Hold also offers a special love and loss bead kit, a keepsake for families to memorialize their baby after enduring a devastating loss in the NICU. Next slide. In addition to referring NICU families to Hand to Hold for support, many hospitals also purchase our educational resources as well as our Milestone Bead programs. So they're used in hospitals across the country, which provides sustainable funding for Hand to Hold to provide free support for all of our families. Next slide. A continuum of care between hospital and home is vital, as moms' anxiety and fears are heightened as they navigate the care of their medically fragile baby without nurses and are often isolated from friends and family due to the baby's compromised immune system. Additionally, after hospital discharge, many parents will return to rural areas and have limited mental health resources. Beyond the NICU, mothers are encouraged to join our virtual support groups and seek counseling via telehealth from our licensed clinicians. That's in Texas and Florida specifically. NICU mothers can also find connection, support, and ongoing education through Hand to Hold's innovative mobile app, our podcast, and our virtual NICU mental health conference, which I'll speak more to in just a minute. Our virtual programs ensure all NICU parents have access to free bilingual early intervention mental health support, particularly for those facing mobility or geographical constraints. Next slide. NICU parents can also be matched with a trained peer mentor during their hospital stay or once they are at home. We have more than 250 trained peer mentor volunteers. We match the new NICU and bereaved parents with a mentor who has a shared similar birth experience. Support is provided in English and Spanish by text, email, phone, and video chat, whatever works best for the NICU parent. Peer mentors inspire hope, and they offer new parents the chance to ask personal questions and receive support from someone who is uniquely familiar with their experience. Proven benefits of peer support include improved mental health of the parent, improved problem-solving capabilities, greater engagement by parents in their child's care, and increased preparedness when caring for their medically fragile baby. Next slide. Hand to Hold also offers a weekly virtual support group in English and Spanish, utilizing the same proven curriculum that we're using in the hospitals. We run these virtual support groups daily. We host many different groups to meet the individual needs of NICU and bereaved parents. Next slide. Hand to Hold is also so proud to be able to offer free counseling to NICU parents in Texas and Florida. Parents can attend up to 12 free sessions with our licensed clinicians, specifically trained in trauma, grief and loss, and perinatal mental health. Our counselors help parents process their birth experience, grieve the loss of the NICU baby, and treat perinatal mental health disorders. Through our programs, NICU and bereaved parents have improved mental health, learned to bond with their babies, and become confident and resilient caregivers, which in the long term improves the baby's long-term physical, emotional, and developmental outcome. Next slide. Hand to Hold created one of the first podcasts for NICU parents. We now have more than 100 episodes available. We find that it is often the first resource NICU parents seek. It's easy to access. It's free. They can listen at any time while pumping or driving back and forth to the hospital or sitting at their baby's bedside. It has also been a great way for dads to seek support and information. Next slide. As Gen Z has never known life without a mobile phone and uses apps for everything from ordering their fast food and managing their bank accounts, we knew we needed an innovative mobile app to allow NICU parents a way to easily connect with our support staff and other NICU parents and educational resources. Next slide. The app is a safe place for NICU parent connection across the U.S. The community is moderated by Hand to Hold staff and offers multiple groups with the app for moms and dads and bereaved parents as well. We love seeing parents share milestones, photos, and encouragement with one another. The app also offers an educational library designed for today's parents with topics to help parents navigate their NICU journey. The articles are quick and easy to read, and they're also easy to share with partners and family members. Next slide. We also host a podcast for NICU professionals. We currently have more than 25 episodes ranging from preventing burnout to supporting the mental health of dads in the NICU. CEUs are available for each episode. Next slide. Our certified mental health peer specialists bring invaluable lived experience to their roles, enabling them to offer empathy, understanding, and practical guidance to parents facing similar challenges. This shared experience creates a very unique bond and a level of support that is difficult to replicate. By tapping into the experience and resilience of parents who have walked a similar path, we've created a supportive ecosystem where families feel understood, validated, and empowered to navigate the complexities of the NICU environment with confidence and resilience. We consistently evaluate our programs and provide parents with satisfaction surveys prior to discharge and following each support group and counseling session. Next slide. Medical professionals tell us that having Hand to Hold certified mental health peer specialist in their hospital allows them more time to focus on the care of the baby, helps them balance patient care and family support, and most importantly, it's helping them understand how to better support and communicate with NICU parents and families. Next slide. Hand to Hold also hosts local and national events. We recently hosted our second annual NICU reunion for NICU grads of all ages at our local Q2 soccer stadium. It's one of my favorite days of the year. This carnival-style family-friendly event is free for all families. We invite NICU grads of all ages to cross the stage to celebrate their NICU graduation, all they've overcome, and all they're growing to be. Some of our NICU grads this year are pictured there. Next slide. Nationally, we host a NICU Grad Then and Now photo contest. Last year, we had more than 1,600 grads participate from 50 states. We launched on Tuesday, so I encourage you to tell all of your NICU families about this contest, even if they're not ready to enter. Just looking at all of the then and now photos and reading the stories of NICU grads of all ages, all the way up to adulthood, inspires a lot of hope for NICU families. Our winners, next slide, are recognized in our NICU Grad Then and Now calendar, which features their amazing NICU journey stories. We can make those available for purchase next year when we have our new photo calendar ready. Next slide. Each year, we also recognize the amazing NICU professionals who ensure our NICU grads have the best outcome possible. We invite NICU parents from across the country to nominate their NICU heroes. The winner is then recognized at our annual Hand to Hold NICU Mental Health Conference. Next slide. We invite all of you to participate in our mental health conference this year. The date is set. It is a virtual conference. It'll be Wednesday, November 6th and Thursday, November the 7th. Again, it is virtual, and we invite parents and professionals to connect, to learn with and from one another about the importance of mental health support in the traumatic environment of the NICU. The conference features inspiring and thought-provoking speakers on trending and emerging topics about health equity, burnout, self-care, trauma, informed care, and grief and loss. We offer continuing education as well. So hope you'll join us November 6th and 7th. Next slide. Hand to Hold hosts this conference, produces podcasts, and all the other things that we've talked about today, because we fundamentally believe that mental health support has to be a cornerstone in the care of NICU parents, as it helps protect the long-term mental health and development of the NICU baby. We continually evaluate and evolve our program to reflect the changing needs of NICU and bereaved parents based on the latest research, direct parent feedback, and ongoing satisfaction surveys from our families. Our flexible approach ensures that our support remains responsive, relevant, and impactful, and enhancing the well-being of today's NICU parent. Next slide. In a recent journal article published by the National Association of Neonatal Nurses, Jessica Barnes, a NICU nurse who became a NICU mom, shared her unique perspective from both sides of the isolette, and she advocated that parenting in the NICU remain at the forefront of improving care for NICU babies. She advocates for NICU professionals to help validate the parent's role in the care of their child and to meet parents where they're at, knowing that their lasting impact of their words and their support on the NICU parents' transition into parenthood. Next slide. I honestly could not agree more. I've spent the past 20 years using my story and my voice to advocate for hospital-based early intervention mental health care and the continuation of that care beyond the hospital doors to ensure better outcomes, long-term medical, developmental, and emotional outcomes for the NICU babies, because we know that family-centered care helps to mitigate the impact of perinatal mood disorders, improve parent bonding, insulate babies from abuse and neglect, improve the likelihood of parent buy-in to therapy and follow-up care, and thereby, again, improving the infant's developmental outcome. Next slide. So my Jackson will turn 24 this summer, and while his little body is still covered in small scars from his NICU stay, most parents and most people would never know the challenges that he faced at birth. Thanks to years of occupational speech and physical therapy, he overcame most of those obstacles. He recently graduated from college with honors, I'd like to say, and he is now pursuing his dream of making movies in Hollywood. He just had his first movie come out, so we're beyond proud of him and all his accomplishments. Because of amazing medical professionals like you, outcomes like Jackson's are not, they're now commonplace. Many babies have very positive outcomes, but parents need support and education and resources during and after their NICU stay to ensure more happy endings like ours. It has been and continues to be my mission to ensure that every NICU graduate has every chance to meet their full potential, and I know it is yours too. It's why you're here. And it's my hope that this task force is the sea change that we need to establish standards for the delivery of family-centered care in NICUs across this country. Next slide. At Hand to Hold, we're focused on the expansion of our virtual support to remove barriers and serve more families. We're constantly innovating to find new, cost-effective programs that will enable us to reach more NICU parents. We believe by embracing creative solutions and pushing the boundaries of traditional approaches to mental health care delivery, we are driving positive change, and we're empowering families and healthcare providers with the resources that they need to navigate the complexity of the NICU journey with resilience and strength. Next slide. If your NICU does not currently offer NICU parent support and lacks resources for post-discharge support, we invite you to refer them to Hand to Hold. You can visit our website at handtohold.org to order our referral cards. Use this QR code. I know the slides will come out in the next few days. And you can order those referral cards. The cards are free. We just ask you to pay for shipping. So last slide, I just want to say thank you. Thank you for this group. Thank you for all that this task force is doing. And thank you for the opportunity to allow me to speak today so that we are all in this together. And I just so appreciate the support of this group and so proud of what we've already accomplished together. Thank you.
Thank you so much, Kelly. We do have a few questions for you, and if anybody else has other questions, please go ahead and drop them in the chat. I am going to kind of scroll back and see some of the first ones had to do with when you talked about your support group curriculum, and is that something that's available to any NICU?
We've talked about that. We have. So I would love to have a conversation with the person who's asking about that.
It was Malathi.
Let's talk about it. It's certainly something that I want to consider. I'll just say we'll take that offline and talk more about it. We have not yet made that available for free beyond the hospitals that contract with us.
And then that's kind of a follow-up to her next question, is that you do work in a kind of a contractual relationship with the hospitals where you're providing the in-person services, but
Right.
your other services are available just to anybody, any parent. Is that correct?
That's right. So parents can find us themselves. Many do when they just Google support. They're coming to us. They're finding us in their app store. They're finding us wherever they find their podcasts. They just go directly to our website and request support. And again, the counseling is specific to Texas and Florida. We're wanting to expand that, but that is certainly our most expensive program. But we're working on some innovative solutions to that as well that I'm really excited about.
And then your NICU Heroes podcast that offers CEOs, is that just for RNs or does that include social workers as well?
That's a great question, and I honestly don't remember. I would have to look at that. I can't remember which one, if we were able to get it for both. I know right now it's RNs, but I think it's social workers too, but I would have to investigate that more.
Okay. And do you have a link to register for the conference yet?
Not yet, not yet.
Okay.
We are working on all of our speakers right now. It was Ben Rattray. I think you might have seen that we've secured him as one of our keynotes, but we're still working on the lineup. But we will, I will share it through this group if that's okay when it's ready, and we'll invite all of you to register. And invite
for those
parents
oh,
too.
sorry, go ahead. Yeah,
No,
and there are several that would like to talk to you offline about bringing services to their hospitals. What's the best way for people to reach out? Should they reach out to you? Is there somebody else they should talk to at Hand to Hold?
Yeah, let's just have them go directly to me right now, and I can field those appropriately and schedule those meetings. But Kelly at handtohold.org would be great.
Okay. All right. And let me just see. I think that was all of them. Somebody else mentioned your Hand to Hold Facebook group is also very helpful.
Great.
And yeah, and Megan said thank you for paving the way for all of us. And I will echo that as well. And
I can see the hand raised for Tamara. She raised her hand.
Oh, yes, I'm sorry. Go ahead.
Thank you, Kelly, for such a wonderful talk. My question is about how families are referred to Hand to Hold and whether or not the organization collects any language, race, and ethnicity data, and if the families that access Hand to Hold are similar to the demographics of NICU admissions in the states that you serve.
Those are great questions. I don't know that I feel confident in answering those with with confidence right off the bat. I would like to look at if they do reflect. I would think that they do. We get I mean, we have families of all ethnicities reaching out to us, but if it mirrors the makeup of the NICU specifically, I'm not sure. But of course, we do have, a lot of Spanish speaker requests for our volunteers mentor program, but also coming to our Spanish groups, our support groups. And in our counseling, being able to provide counseling in Spanish has been really important. So I think they are coming to us. Yes, any hospital can refer directly to us with the referral cards, but the parent typically contacts us themselves. They're reaching out to us and saying they want support, and then we're scheduling their one-on-one appointments with either our certified mental health care specialist, or if counseling is deemed necessary, we do have the screening tools and process that they go through with our counselors.
Thank you so much.
Absolutely. Follow up with me on that question if you don't mind, because I would actually like to look at that and make sure we are tracking appropriately.
I think that looks like those are all the questions we have. So I will turn it back over to Malachi to close our webinar.
Okay, so I believe it's Morgan, but I can close the webinar. I'm okay. Are you okay, Morgan? Okay. Yes, thank you for this amazing talks, and I'm so thrilled, and I'm going to go back and look at all the references and learn a little bit more about everything that you guys shared. And thank you, Tamorah, and thank you, Kelly, for your time and participation. Then this is not stopping here. So we have a continuous webinar we planned until next year of May. So here are all the listed in this slide, and next one is on July 11th. And Paige Church is a neonatologist, and Beth Israel, and she is going to talk about families as neuroprotectors in the NICU. And Mia Malcolm is going to be talking about delivering hope through words and power of effective communication in the NICU. It's a continuation of what we learned today. So please join us. It's on July 11th and same time, 11 a.m. Pacific. And so we have lined up for September, November talks already. So hope to see you all in the next webinar, and stay in touch. Keep the great work going.
Thank you all so much.